Good afternoon. My name is Jason Thornton, and I'm the Senior Nursing Director in the Cardiac Intensive Care Unit at Boston Children's Hospital. I've been a nurse for about 27 years, with nearly the last 13 years in my current role. The CAMEO was originally created in 2009 and has been developed and refined in the years since, whereas we are now at version 3 of the tool. Before the CAMEO, there was a fair amount of difficulty in how nurses communicated all of the work that came with caring for a patient. The tangible, visible things were easy to convey, like an ECMO circuit or multiple infusion pumps, but all of the other invisible work was difficult to quantify and more difficult to verbalize. In this regard, the CAMEO has since become the voice of the nurse. It was validated by input from thousands of direct care nurses from across ICUs in 9 different sites. It allows units to see all of the work that goes into caring for a patient over a 12-hour shift distilled into one single number. This current version of the CAMEO has been certified by the Massachusetts Department of Public Health and is deemed compliant with the Massachusetts Safe Staffing Law on nurse staffing, which was enacted in 2014. Along with the CICU, the CAMEO has also been implemented in our 3 other specialty ICUs, our pediatric medical ICU, our medical surgical ICU, and the neonatal ICU. In 2017, the CAMEO Acuity tool was implemented within the electronic medical record, allowing for a streamlined process for bedside nurses to complete on a shift-by-shift basis. This allowed for greater ease in collecting and reporting on acuity scores and increased our compliance. In June of last year, we moved to Epic, a new electronic medical record system, where the CAMEO has also been embedded. Through Epic, the bedside nurses and charge nurses have views of patient CAMEO scores. This dashboard is enclosed within the Epic application and indicates patient records with the CAMEO score color-coded by classification. For example, a level 2 score is blue, a level 3 is yellow, 4s are orange, and 5s are red. From the data collected on the CAMEO scores, we are able to chart trends over time. We can look back month to month and view the percentages of each of the 5 classifications. We can also view and compare patient acuity over time by each of our ICUs. And in viewing these, we can see when we have a higher proportion of CAMEO 4s and 5s, and that can help us justify when we need to overstaff. This enables the utilization of the CAMEO scores to truly inform decision making. A key differentiation in utilization as nursing director is that I use these scores to advocate for FTEs and long-term projections. As surely acuity rises and falls over time, this is an important data point that I'm able to use to strengthen my argument for increasing our FTEs or perhaps adjusting our model of care. Sonia, in her role as charge nurse and one who facilitates scheduling, uses this information to guide staffing on a day-to-day basis.